I do think it does take time to discuss these drugs with patients because you need to inform them when they're taking the drug, how they're taking the drug, what to expect in terms of side effects, what they need to call us about, what they need to come in for, why are we monitoring them, what are we looking for, and then I think also to make sure there's good adherence to treatment. And so, it is a discussion, just with all oral therapy. I do think it does take time to review these things. But I think if that education is provided up front, patients usually know when to call us. They know to call if they're having loose stool on abemaciclib. They know to call if they have a fever. And those are things that we do tell them up front. We counsel them on how to manage nausea or diarrhea up front. We often provide those medications to them prophylactically before they've started, so they have an armamentarium at home from which they can choose from if symptoms arise. And again, I think, as Lindsay alluded to, I think communication is so key. If the patients are aware of what to expect and then can communicate back to us with any side effects that they're experiencing, then we can certainly help, whether it be dose holds or help them understand how to take their loperamide. And I think it's usually very doable.
Patients will see Sarah when they're initially changing therapy, but then before they start taking the medicine, they'll see me once again for usually cycle 1, day 1, or even prior to cycle 1, day 1, and I'll repeat and go over everything again and make sure they have all their prescriptions for their anti-nausea medication, their anti-diarrheal medication. And I'll often say to them, if anything happens or you're not feeling well, you feel nauseated, you have loose stool, just call me. Call me right in the moment and we'll talk about what to do and how to manage things.
Well, certainly over the last few years, we've had a number of FDA approvals for new agents. So this is becoming a more common issue where we do have to inform our staff about new agents as they get approved. I will say we also create internal clinical pathways. And so these are regular meetings that we have to review any new FDA approvals and how they would fall into our pathways. And those are sort of unique times when we can discuss with our staff what they really feel clinically we should be using these drugs for and in which settings, but then also to review toxicities that arise with these agents and whether internally we need to have plans in place about how to manage side effects as they arise. Because I do think it is important, as a group we like to practice in a uniform way, and so we do like to have these discussions up front as new drugs come out.
And there's a lot of discussion amongst all of us in the clinic about making sure everyone's doing best practice and educating each other just on a day-to-day basis.